We're going to get started here in just a minute. We're going to go ahead and give a few seconds for other attendees to join, and then we'll jump into the AHF webinar. All right, let's go ahead and get started. My name is Janelle Rupp. I'm with Performance Reps Northwest, and I'll be facilitating today's webinar. Please note that this webinar will be recorded, and all participation lines will automatically be muted during the broadcast. Today's webinar will be 60 minutes long. At the end of the webinar, we will host a Q&A session with our moderator and panelists. You can type questions throughout the webinar, and we will address them at the end, or you can type your question when the time comes. Simply type your question into the question box in your control panel for this webinar. Our webinars are meant to be interactive, so be sure to ask questions. Our webinars are a great opportunity to engage with our AHF experts, so please take advantage of it. Now I want to go ahead and introduce our speakers today. I can advance my slide. There we go. We have Betsy Craig and Beth Winthrop. Betsy Craig is the nation's leading expert on food allergies, menu labeling, and food safety. Betsy is an award-winning CEO and founder of Menutrinfo, LLC. Besides menu labeling and nutritional help desk needs, Craig's company, Menutrinfo, is the parent company of Allergen, a food allergen and gluten-free food safety training suite of courses, and Kitchens with Confidence, a certifying and accrediting kitchen auditing division. This newest division helps manufacturers and commercial kitchens to be called certified free from certified free from one or all 8 major food allergens and or gluten. Menutrinfo is dedicated to helping hundreds of thousands in food service protect the lives and health of their customers. Joining Betsy today is her colleague, Beth Winthrop. Beth is a food allergy specialist and Allergen master trainer for Menutrinfo and adjunct faculty for the University of Rhode Island and Sal Virginia University. She has over 28 years in healthcare. Beth Winthrop received her BS in nutrition from Cornell University and completed a combined master's degree and dietetic internship at Tufts University and the Francis Stern Nutrition Center in Boston. She's had a long career as a clinical nutrition manager, regional clinical, and dietetic internship director for Sodexo Healthcare, spending the past 8 years with Sodexo Universities. Beth developed the MyZone Personal Pantry and Sodexo Simple Servings, the allergen-safe resident dining option, which won Food Management's 2013 Best Wellness Concept and the 2017 Allergen Best Food Allergy Innovation for Universities Award. We're excited to have Beth and Betsy with us today, so I'm going to go ahead and let them take over.
Thanks, Janelle. Let me just, yep, I'm good now. And hopefully it's going to let me share as well. Give me 1 second. Welcome, everybody. I'm glad everybody joined us today to talk about food allergies. Food allergies are a big deal, and we're going to jump right into it here in just a moment. First, thank you, Janelle, for asking us to do this, and thank you to AHF in the Pacific Northwest, one of my absolute favorite places to be ever, as well as anybody who's watching this after the fact online. We're glad you're joining us. So let's jump into just a little bit of information to start. Menutrinfo, the company I founded with my husband back in 2010, exists to inform people what's in their food so that they can eat with confidence. We began as a nutrition company doing menu labeling for restaurants and making allergen charts. Fairly quickly, we rolled into creating Allergen, which was the first ANSI accredited training program for allergies in this country. We got accredited back in 2014. We're now one of 6 companies that's accredited, but we got to start the trend. We do the certified free from areas and products. So they're free from any or all of the big 8 allergens here in the United States, and consumer goods, as well as sections of dining facilities. And then finally, we do food allergy solutions, kind of wrap everything together and do a package approach, a complete approach within the company. At this time, I am so excited, you guys, that Beth agreed to be part of this with me, because, you know, she just laughs at me sometimes because I think she's just an amazing rock star and her career is really amazing. And especially to this audience, she's lived your life. Like, she gets it. She gets what you're doing. She gets what you're challenged with. So I'm going to go on to the next slide and turn it over to my partner in crime, Beth. You're muted, Beth, but you're smiling. So that's good.
Better if I am not muted.
Small detail. Go, girl.
So I'm really happy to be here in the self-op world. And I certainly have lived your life, if that's sleeping on the office floor and getting up in the snowstorm to make breakfast, make sure everybody gets it, washing dishes by hand when the dish machine is down, lots of things like that. So I get you guys for sure. So I've been working for the last 9 years or so with universities. Before that, my entire career was in a large 3-hospital system, 900 beds. But you certainly hear a lot in the news about food allergies occurring with university dining, but hospitals are not immune from food allergy reactions. So this article that I have on the screen, very thought-provoking article from Allergic Living magazine. It talks in detail about food allergic reactions that occurred with admitted patients who received foods that they were allergic to. And as we know, these days you have to be pretty ill to be a patient admitted to the hospital. So having an anaphylactic reaction to a food on top of that is pretty scary. And I know, and you know, that we spend every day looking at food safety and physical safety and slips, trips, and falls and safety shoes and time and temperature control and all those things. But a food allergic reaction can actually kill you much quicker than salmonella. So I think that needs to really get on our radar screens in hospital dining in a big way. Could I have my next slide, please? So a lot of the problem with food allergies in hospitals, as you might expect, has to do with the electronic health record. So I'm sure that diet office systems and getting that diet order correctly from the nursing units in a timely manner and knowing where the patient is, on what unit, in what room, you know, have they just been made NPO for a procedure? Those are things that we deal with every day in hospital food service. But making sure we get those food allergies and get that information quickly, and also pull that information from previous admissions. So if you have a new diet order, you pull that food allergy from a previous admission along with that. So there are certainly mistakes in administering medications to which patients are allergic. Those are counted as preventable adverse drug effects, and they receive a lot of attention. Food allergies are actually a bit more complex than medication allergies because it's less black and white. So if you are allergic to penicillin, you shouldn't get penicillin. If you're allergic to milk, eggs, wheat, gluten, soy, you shouldn't get meatloaf. But probably your average nurse on the units has no idea about that. So you guys have to build a lot of the back end of systems to make sure that the person with the egg allergy is not going to get that meatloaf. Person with the egg allergy probably shouldn't be getting some vaccines or total parenteral nutrition either. So this is information that has to be shared between the physician, sometimes nursing, always, dining, always. and sometimes pharmacy too. The other thing that happens with food allergies is that that's often required to be entered as a free text allergy. So that is always an accident waiting to happen if you are entering things in the electronic medical record as free text rather than a drop down. That adds a lot of possibility for error. Could I have my next slide, please, Betsy? So another thing to think about is that you wind up with a lot of food allergic patients having reactions in your emergency department. So in my experience, the systems that we use to feed people in the emergency department are often different. The turnover is very rapid. You have people getting admitted, people being discharged, people moving up to the patient units. So sometimes we'll do things like have sandwiches and beverages and fresh fruit and so forth available that the emergency department staff can just pull and give to a patient. So a lot of the systems we have in for cross checks of what tray and what foods we provide to somebody with a food allergy maybe are not as good in the emergency department. There's also questions about if people have a food allergic reaction, how long do they stay in that emergency department? A biphasic reaction or a secondary reaction can happen up to 8 hours after that initial reaction. Are we keeping people that long? I'm pretty certain we're not in COVID times, but even in the before times, I'm not sure we're keeping food allergy reactions that long. The other thing is what this article is about, and that is that it's very different from hospital to hospital or even physician to physician as to what are the indications to actually admit somebody that has had a food allergic reaction. How sick do you have to be? How many EpiPens do you have to receive before you're going to spend the night in the hospital? And that is an area where there is not a good clinical recommendation to do that. And there's quite a lot of variation between hospitals. So lots of things to think about when it comes to food allergic patients in the hospital. And 1 in 10 adults is allergic to some food. So I can guarantee you that you have some food allergic patients in the hospital right now. And I'm really happy, probably after Betsy's done, to talk about any details that you want to think about. Is the pot sink better than the dish machine? Whatever you want to talk about, I've been there for a long time, so I'm happy to do that.
Thank you, Beth. Beth, can you hear me? Can you give me a thumbs up if you can hear me? Thank you. Because of the webinar platform, we're not necessarily seeing everybody, so I want to make sure you could hear me. And I will remind folks to go ahead and send the leaders, the AHF folks, your questions through the chat. I won't be able to physically see them, but they'll feed us the questions in just a little bit. Do you see how I did that? I did feed. Okay, just making sure you're up. It's the end of a day, or it's the end of the day out east. I guess it's the middle of the afternoon for you guys out there in the West Coast. So let's talk food allergies, because that's why we're here. Allergens, food allergens here in the United States went from 15 million folks with food allergies in 2011 up to 32 million in 2019. People talk to me all the time saying, we don't know where it came from. It's amazing. I've been in food service since 1979. And when I was working at the Ponderosa, we sure didn't have this many people with food allergies. It was, you want grilled onions or you want that mushroom gravy, yummy, yummy. And nobody was allergic back then. And now it's like every 4th or 5th person has a request. It might not be an allergy. It might be a preference, or it might be celiac, or it might be, I'm eating vegan or vegetarian, or, but more and more, the community that we serve in dining has requests. They have a lot of requests. In the US, we have the top 8 allergens as of today. Today is March 4th, 2021, and these are our big 8 allergens: peanuts, tree nuts, wheat, milk, soy, shellfish, fish, and eggs. There's big discussions about coconut, that coconut really isn't a nut, a tree nut, that it's a fruit. However, it is declared as one of the tree nuts according to the FDA here in the United States. So we have to count it in as a tree nut. Why do I see mustard as an allergen on labels? So I put a couple questions up here because I knew we'd be on Zoom, and Zoom's really hard because how do you stay interested if people can't shout questions and I can't see your faces? I just imagine you all smiling and following along with me. So that's why you're seeing some questions here, just to keep me entertained and hopefully to forward think what you're asking. Mustard as an allergen on labels happens because mustard is an allergen in different areas, and has to do with seeds. And it's definitely just north of us in Canada, it's an allergen. And new happenings in allergens. So we're seeing some really cool stuff happening when it comes to food allergies. We have a study that happened called the LEAP study, and talking about introducing allergens, specifically peanut protein, to infants when they're young and younger to help get their systems used to the protein peanut. Also, there's some research that's been done for helping to get rid of allergies in certain people based on protocols within their allergist. So it's kind of exciting to see some tiny little spark of light at the end of the tunnel. It's not huge yet, but we're a lot better off than we were 10 years ago. Pardon me, excuse me. So if you look at the certified free from seal, and this is our seal, we have a seal that's all ready to go with the top 9 allergens, because there's a big question is when is sesame going to hit? So for years, we've been teaching through Allertrain that sesame is one of the most popular allergens that's not one of the declared big 8. Sesame is definitely popular. There's like 1.5 million people in the US allergic to sesame. It's a very common allergen. Right now, the FDA here in the States went ahead and asked for people to do a voluntary disclosure of sesame on the label. So it's a good and bad thing, because it's voluntary. Not everybody's mandated to do it, but we are starting to provide more information about sesame. I will tell you that sesame, the legal side of this, it's an act in DC called the SAFER Act. And that is part of the SAFER Act, is to declare sesame as the 9th allergen here in the US. And it made it through, I want to say, the House, not the Senate, or the Senate, not the House, last week. Like, I can't believe they're doing this in the middle of what we all have going on in DC, but it's still progressing in DC. And so that's really positive. Once it's declared an allergen, then we will start to see it on labels. We will start to be able to certify free from. We will add it across the board on everything. 8 allergens is a low number compared to other countries, especially like Canada's 11, Europe is 14. So 8 is kind of mild. So I'm not surprised they're looking at 9, and I bet somebody will tell us what 10 is going to be right behind it. Okay, what is a tree nut? This is a poor young soul going through allergy testing to determine which nuts they're allergic to and what a positive reaction looks like. And you can see the list of all the different tree nuts right there down the left side of your screen. It's important to know them. It's important that your staff know them. If somebody says, I'm allergic to tree nuts, definitely your chef needs to know what a tree nut is. There are a lot of places online where you can download these lists. We at allertrain.com in our store sell a commonly used names list. But once somebody discloses to you, even if it's not a patient in a room, but somebody walking through a cafe that you're responsible for, knowing all the different names is really key. What about gluten? So what is gluten? Gluten is a stretchy protein that allows air bubbles to be captured in wheat bread. Corn doesn't have gluten, so you can see the texture of the cornbread. Now, I'll tell you, from what I understand, and I learned this right before going to France, the bigger the air bubbles, the better the bread. And I want to let you know, I personally tasted that to make sure. I tasted it everywhere I went. I put brie on. I'm very lucky I can eat gluten. Gluten-free is a tough diet and a tough lifestyle, but it's the only way to go if you have celiac disease. I've heard people with celiac disease that once they get glutened and accidentally ingest gluten, it can be instantly throwing up, instantly defecating themselves. They might need to get carted out on a gurney. I mean, I have heard some pretty extensive reactions to gluten if somebody has celiac disease. And what's interesting is for years we've been saying, oh, celiac disease isn't as bad as an allergen. And I'm starting to change my mind on that, because I'm reading case study and I'm seeing examples where it really is quite severe. The other thing is, in 2010, when we first entered the business and this side of the industry, been around it forever, but this side of it, I started talking about gluten-free, and people are like, that's a fad, it's Atkins, it's never gonna stick around. Well, wouldn't you have liked to invested in gluten-free back then? Holy cow, it's like Amazon stock when you could buy it for 48 bucks. I mean, holy cow, gluten-free is everywhere. It went from bad tasting, barely edible cardboard to now there are things you can't even tell it's gluten-free. And so we've come a long way on that one, that's for sure. I'm sure you're getting requests on gluten-free. So this is something that I borrowed from FAIR, Food Allergy Research and Education. It's a nonprofit 501c3 company based in McLean, Virginia, that does a lot of advocating for food allergies. We work with a company called FACT, similar ideas, similar missions. I did discover there are 13 different food allergy groups, and we may get into that, but FAIR did this study that I wanted to share with you. So 1 in 4 American consumers won't buy a product that contains one of the big 9. 1 in 4. These people are coming through your lines. They're coming to visit somebody if they can get in the hospital on their best or worst day. Depends upon if they had a beautiful baby or if they're having some challenges and coming to you to take care of them. The amount of people that we are seeing requesting special diets has so skyrocketed. And this is the research to back that. And if you jump on FAIR's website, you can, I'm sure, download it. There's an infographic that these 2 sections are a piece of that infographic. As you see, there's some celebrities now up on your screen. I tend to be a football person, so I like the 2 guys towards the top right. Every person on this screen can get taken down by a small amount of food, like 1 milligram of food, whether it's fish, shellfish, or gluten. Food allergies are very prevalent and they're very common, and it doesn't matter how big you are or who you are. I recently had an interaction with Mark Cuban, who's the guy on some TV show about how to do entrepreneurs. And he has a child that has a food allergy. And it doesn't matter who you are or where you're coming from. Obama has a daughter that has food. When he signed into law, he talked about his daughter's peanut allergy. I mean, it's a common denominator, no matter how big or how small. I will tell you that it is more prevalent in the Black community, and it's not as well treated in that community as well, which is kind of a shame, and another area that we as a country should be doing better. What can you do to accommodate the food allergic diner? What can you, dining service directors in your environment, what kind of steps can you do to make a big difference? We have the routine, we have the reasonable, and then we have the rock stars. And there's different levels you can do. Just being on this call, just trying to get educated up on what's happening in food allergies already is putting you in the routine for sure. So such a small amount can cause lethal anaphylaxis, like Beth was referring to before. This is just simply 1 milligram of peanut can absolutely take somebody down and take somebody out if they don't get proper medical care or have the proper medicine, epinephrine, at the time they need it. We do, as a company, we do these certified free from areas or audits, and I'm going to talk about that for a second and then a couple more slides, and then we'll be able to take questions. So please feel free to throw some questions in the chat. I always like questions. If not, I make them up. So send me some questions. Let us help you. We do this certified free from, and this is done in areas of dining So you can have a section that's certified free from. In Beth's bio, when she was introduced today, they talked about what she created when she was with Sodexo, the My Zone and the simple servings. I almost forgot the name of it, Beth. Can you believe it? And the food allergy kitchen. So you can carve off a space that's safe in your dining area behind the line to provide a safe environment where things are free from. It takes some work. It definitely takes some prep, and it takes a whole lot of heart to get this done. But we are seeing this just play out in different parts of the country where it's so well received. I'm going to tell you a story here. So Michigan State University decided they wanted to do a free from area, and they wanted to be free of gluten and the Big 8 plus sesame. This is about 2.5, 3 years ago. They went from wall to wall. They went through the exhaust system. They went through sourcing everything. They make their own chicken fingers up there and chicken nuggets. So they had to go through buying additional equipment to make the chicken nuggets just for this area. By the way, this area is called Thrive, and it's a great name because people thrive by eating in this space. When they opened this space, they started getting people from outside the campus that were coming into the campus, into that area to eat because it was safe. This is a place that used to do like not a ton of volume. I'm not going to give the numbers. I'm sure they wouldn't be thrilled if I was sharing that with the world, but it wasn't super great volume. And when they opened up, they started doing great volume, and they did up until this funky little thing happened called COVID. They're getting ready to reopen. And it really hurt the community that it shut it down because so many folks were starting to really depend upon it and go there and take kids out for the first time and take family members out for the first time. So accommodating this diner not only is the right thing to do, you get a lot of kudos for it. Okay, so this is some of the college logos there. We have Eat at State. I was just talking about State. Michigan State there. These are the folks that we have started back in 2017, and there's a couple or 20 more. So when we come in and do it, and I'm putting this out there because I think you guys could almost work together, or you can have a friend that's in this business come over and use their fresh set of eyes looking from the loading dock to the tabletop as far as how you're doing with food allergens. When we come through, we go soup to nuts. I mean, we want to check everything, front of house, back of house, protocol, standard operating procedure. Do you have extra equipment? Do you have training? Is it ANSI accredited training, or is it training that, you know, y'all made up yourselves? Whatever, we want to know all the different pieces and parts. Do you have special smallwares? Do you have purple items in your kitchen? All of those things work towards success for a food allergy win in dining, that's for sure. So what lengths do we go to serve safely and prevent cross contact? First, let me tell you, we don't call it cross contamination because it's not about contamination where you can cook it out or it's time and temperature. It's contact. It's one item touching another item, and it can happen in tons of places in your back of house, from the line back. So we look at toasters and all different kinds of equipment and how your cleaning process is, what utensils you're using, even something as simple as a thermometer. Putting a thermometer in the meatloaf that Beth just described, and then putting it in some green beans. If it's in the meatloaf and you think, well, it's just meatloaf, until you have an egg in there, if you make it the way I make it, or if you have breadcrumbs in there, the way my mother made it. Why do we put bread? Okay, not going there. So is the thermometer touching allergen items and then touching non-allergen items? That's why we need 2 thermometers, my opinion, my belief. Get a purple one. Make that purple one be for allergen-free and gluten-free, and the other one for everything else. Big debate with a health inspector out of Texas who told me all the different reasons he could wipe it clean on his sleeve, basically. I love those kind of conversations. I just let people talk and dig deeper till I give them the reasons they can. So what are the systems in place to have successful allergen service? And then fryers. Oh my gosh. If I could tell you how many people believed if you fried something, you fried out the allergen. You don't. There's no way to do it. It's scary. The National Restaurant Association just did a survey they released within the last year, and I forget which month because the last 12 months are a blur for all of us. But in that, they interviewed over 1,200 restaurant chefs, owners, and more than 25% believe they could fry out the allergen. Hello, this was 2020. The survey was done in 2019. I'm like, holy cow, we still have so much to teach. Tabletop ovens, this is a win. Let me tell you how much this is a win. First off, the oven you're seeing on the right is not that expensive. It will pay for itself over and over and over if you do a tabletop oven and you make that be a gluten-free oven or a safe oven for allergens. But it's just the little things that matter. And the consumer sees that and they consider you a safe place. Now they're going to eat safe and feel safe in your building. You're running hospital food service. We all want to be safe there. This is a slide just kind of showing you of what is available within the different brands. There's the management companies out there that have named their stations that are free from different things. They're all following that top one that this lady with us here is the one that was the brainchild behind. But we have Simple Servings, we have True Balance, we have Pure Eats, we have Clean Plate, we have Thrive, we have, oh my gosh. And in the name, you're hopefully communicating to your clientele that it's safe to eat there. Again, keep in mind toasters, hot service bars, you know, cold back when we have buffet, which I think we're going to have it again. I really do. But the idea is, could you do a cart like you see in the top right or the top left and have that always be exclusively free from? Yes, you can. You absolutely can. And just a quick tip, if you are setting up, when you get to set up your salad bar again, we always love the tip and share it that use the beginning of the salad bar to do everything that's allergen free, and then use the dressings as the divider, and then put the nuts and the eggs and the cheese after. I know it's wacky, but what you've done is just made the salad bar safe for anybody with food allergies. They go up to the dressings and then bounce. And it's a simple change. It's just a reframing what you're doing. Doesn't spend any more money to do that. Okay, I had to put a cat. I realized at this point, I'm like, I better put a picture of a cute kitty or something. We need something. Okay, so what about airborne allergens? Well, what are you eating? It's interesting because people get all crazy about airborne allergens. And for years, I've rarely heard of somebody going into anaphylaxis because of airborne. And I get every story. In fact, when I used to travel before, when we could all travel, I wouldn't tell people what I did on planes, because as soon as I told them, then I got to hear about all their stomach problems and their GI tracts. And before we're off the plane, I'm going to hear how often they poop. And I just don't want to do that. I just want to sit on a plane. However, this airborne becomes a big, huge debate. And it's like, holy cow, they're not cats. Food is not cats. But here's the truth. There are some people, it's rare, but there are some people that are allergic, so much so that in the air particles can knock them out. So where are we frying things? Where are we frying them? Are we frying everything together? Do we have a separate fry area? Are we aware of what scents and what particles are going to go up in the air? I believe my next slide, nope, I don't. I'm sorry. I thought I had a slide that talked about this. The number one allergen that becomes airborne and knocks people out at the knees is shrimp, shellfish. And that is actually the story that I have heard that I trusted source, and I absolutely believe it happened. I have heard people talking about peanuts and airborne peanuts, which is why we're all so grateful that Five Guys has there's peanuts in here. Don't come in if you have a peanut allergy. Like, that's on their front door. That's on all their doors. They have a great little sticker in their red and white colors, and it says that. But I have heard the story of a young gal that worked at a location, and as she was at work in back of the house. And as she was walking through a kitchen, she passed the fryer where they were making shrimp, and she literally inhaled and went down. And thank goodness they knew what was going on. They knew what to do. Somebody grabbed an EpiPen. She had one, and they injected her. Now, this was 2010, 2011. It was just after we got in the business, and it was way before generic EpiPens. I mean, way before. So most states allow you to have a generic EpiPen in your facility. You need a medical, pharmacy slip. Prescription. That's the word I'm searching for. There it is. You need a prescription for it. But in this day and age, I would go get 2 of those pens and keep them in a cool, dark place till you need them, where everybody that's a manager knows where they are. They can't get too hot because then they don't work. There is a temperature max on that, so be mindful of that. But a simple couple $100, I know we're going to go into that, like how much do they cost, how much it's gone up, but it's a deal. It's a big, huge change. Oh, Beth, I realize I'm talking to hospital people. They probably have plenty of epinephrine. Okay, I might rewind that. I'm always promoting epinephrine because I think everybody should have it. It's an easy drug to have on hand and help people with. It's like an AED. Additional resources for success. We do within our company, we do listing of what goods can be served and used in different areas, because we want to check, like those ingredient listings I was talking about, manufacturers of the goods that we're using in institutions really, we just need to make sure if you're going to have an allergy-free area or you're going to have a gluten-free area, make sure the products you're using are in fact gluten-free or allergen-free. We also do mystery shopping, where we show up on campus anonymously or show up in your dining facility anonymously and tell somebody we have a food allergy and ask for the food. You guys could do that for each other. Like, you don't have to hire an outside company to do that. I totally know you could do that for each other. Those kind of things to help each other out, to see how you're handling food allergies at your facility. Really, I mean, what better way to give care than make sure care is given? Okay, so now we get to roll to questions.
If I could jump in here, I have some question answers just burning up.
Oh, go girl, go.
I'm getting all this flashback to healthcare. So lots of good questions out there. And I do have to comment on epinephrine. So we really push it in universities, but in hospitals, generally, you're pretty close to the emergency room. And if you've worked long enough, you probably had somebody drop in the 90-degree kitchen and have the nurses roar down from the emergency room and come get them. So that is really very nice. So from questions in the Q&A, what about gluten? So I think whenever we're talking about hospital food nutrition services, we have to divide it out into buckets. So the obvious buckets are retail and patients. And then there's probably a little catering bucket over there too. But with retail, you can decide whether you want to provide, keep safe, and market gluten-free items. With patients, if you have somebody that requires a gluten-free diet because they have celiac disease, there is no choice. You have to find a way to provide those gluten-free products. So there is not labeling where if you have gluten in a manufactured product, it has to say contains gluten. That's only true for the big 8 allergens. So we're food service people. We know that wheat flour is gluten, but everybody might not know that beef barley soup, well, barley is a natural carrier of gluten. Some of your ancient grains like farro, people might not know are gluten. So that's a really good thing maybe to have posted for the chefs, just to make sure they really understand what does and does not contain gluten, because it is not on the label. Now, the Food and Drug Administration does say that if you're going to put a product claim on your label to say gluten-free, that does come with a number which is less than 20 parts per million. And there are various and sundry gluten-free certification bodies that would give you a little more information about that. One of the other questions is, what are people allergic to beyond the big 8 and sesame? I've seen people allergic to a lot of other seeds. So if you're allergic to sesame, you might also be allergic to pepitas or something like that. I've seen people allergic to a variety of different vegetables, to spices. There's actually a nasty kind of tick bite that can make you allergic to red meat, which I think would be horrifying as the
That would be horrific. Let me just pipe in. How about celery? I heard of somebody allergic to celery. I mean, people can be allergic to, what is it, 170 different items, I think?
And celery is actually on that top list in the European Union. So that's, I've never seen that personally, but it's definitely out there.
Strawberries, we hear strawberries pretty regular.
Yeah, that's true too. I got another very intelligent question, and I have to tell you, when I moved from my long stint in healthcare into universities, I was like, wow, these kitchens are huge. It's so wonderful. So I know perfectly well that if I go into a university kitchen, 9 times out of 10, I can find a nice little spot for allergy-free production. Oh, in hospitals, that real estate is unbelievable. So there's really very difficult to expand your footprint in a hospital kitchen to find a spot. I would give you a couple of places to look. Do you have a spot where you do catering prep? I know you do catering. So how do you bust out into a bigger spot when you're doing catering? Also, if you have an area where you're doing special things like pureed meals or thickened liquids, that might be a little spot that you can kind of guard just for special things. But I clearly do understand. So we talked about patient, you're required. You have to find a way to feed a food allergic or celiac patient. You don't have a choice. With retail, it might seem a little more like, oh, we don't have space. How are we going to really do this? We don't want to overpromise and say this meal is allergy safe if it's really not. What are we going to do? Well, I remember at St. Luke's Hospital for years and years and years, they had a day that was teddy bear surgery day. So kids could bring in their teddy bear and bring it to the operating room, and everybody would gown up and just, put a couple stitches in their teddy bear and do some good surgery and give them buttons and everything like that. And what the point of that was to bring kids into the hospital in a non-threatening environment so that if they really did have to come to the hospital, they wouldn't freak out quite as much. So having an allergy safe station in your retail area can really do that same thing. If you're a parent of a food allergic child, it is very, very, very hard to go to restaurants. Now, if healthcare is anything like it was 8 years ago when I was there, you serve a lot more people for lunch than you do for supper. So what about doing a special allergy safe meal once a month or once a week, and send a message to all the pediatricians and all the allergists and say, we're having this special meal. We'd like to welcome your patients in. It's for a set price of $7 a person or $9 a person or whatever it would be. And we'd really like to welcome families. I think that would be a great way for you to connect dining services with the overall mission of your hospital, and talk to your administrator and say, we'd like to be part of this initiative of making kids not scared to come to this hospital. Another resource that all of you have, and I'm hoping these two resources work well together, is you have registered dietitians and you have chefs. So you have something in hospitals that we don't have in universities, which is you have dietitians and chefs working closely together to take care of people who have really specific diet orders. So if you are on renal dialysis, but you also have swallowing problems, you may have a renal puree meal with thickened liquids. That is really, really difficult. That's at least as difficult as a food allergy safe meal. So you have systems and you have chefs that know that they're supposed to follow the recipe. They're not supposed to measure the salt in the palm of their hand. They're supposed to measure it in a spoon, because bad things are going to happen to people with congestive heart failure if they just throw that salt in by the handful. So that, again, there's some disadvantages, the small space, but you really have some strong advantages there. And I will stop talking for a minute, let Betsy get a word in edgewise and see if there's other questions.
I don't know, Beth, every time you talk like that, I just learn. I'm still a learner when it comes to you. And I hope I never stop learning as we go along. Those are some great ideas. I did see a question that came up to us having to do with the allergy, the item, and the oil.
Right.
The oil form versus not. We get into that all the time with peanuts versus peanut oil, how people can eat from a peanut oil fried item and if they have a peanut allergy. And that has to do with denaturing the protein through the process to make the oil partially hydrogenated oil and therefore considered safe. The challenge is that even retailers that use that oil will not say it's totally safe. But the oil companies certainly will. And we've been up against that. We do have certified free from areas that are free from soy and with documentation from the manufacturer of soy oil, because there is no protein of soy in that oil. Do you want to jump in and finish that? And then if Janelle, if we have anything else, we can wrap up with that.
So soy oil, I think many people with soy allergens with allergies are feeling okay about soy oil. I have to tell you, most of the parents of peanut allergic children are absolutely not okay with peanut oil. And the question was actually about fish and fish oil. So I'm not sure, I mean, is that like the oil in a can of anchovies or, I mean,
that's interesting.
You know, Asian fish sauce, not okay. Worcestershire sauce, not okay. The oil from a can of tuna, not okay. So
but fish oil in like Smarty Pants vitamins, because we certify them. So we check out the fish oil and the vitamins, and it's zero protein. It's fish oil in that absolutely is fish free when it comes to the food allergen.
A supplement, not a food. That's interesting. I wasn't reading the question that way. I do want to
just took a jump.
A couple more ideas for those of you who have a really small kitchen, a small retail area, and you want to do something nice for your food allergic customers. So think about, do you have like a special display station where you do bowls or you do pasta dishes or you toss salads or something like that? If you do something like that, it's pretty easy to do a rice bowl that is free from top 8 allergens. It's pretty easy to do a rice noodle bowl. You can do fun things with rice and beans and fresh cilantro and lime juice and chicken and things like that. So even if you do something like that once a week, if you have maybe the dietitian sit down with a chef and figure out something you can do allergy free once a week from that kind of build your own or display station, that's a place to start. And that's also a place to let you judge how much interest you have from your retail customers. But at minimum, it's telling them like, we care about you. We know you're out there.
There's one more question that I would like to jump on here. It says, I see processed in a facility with the allergen, but not actually containing the allergen. Do you treat those foods items as containing the allergen? It's challenging because that statement that you're referring to is 100% voluntary. So it's up to a company whether they want to put that on their label or not. Like our list that we go through that people use us as a resource for, we go ahead and reach out to the manufacturer and find out if it's just a covering themselves statement, or if they truly do have peanuts on the line next door. Do they do testing or they do swabbing? If the manufacturer will not be fully disclosing in that and is just really going to do the cover themselves, we would disqualify it. It would get a red do not use on our listing. If the company says, no, we're putting that there because we want you to know that in another part of the building, on the other side of storage, we actually do have some wheat flour, but all the rest over here doesn't, then we would do a different designation in our database and tell people we deem it as safe to use, especially if they're making products and testing. So I know that's a long answer for a simple question. Again, it's a voluntary statement. I know the FDA thinks they're being all great and kumbaya, but you know what they're doing? They're making me crazy, because when it comes to food allergies, there's black and there's white. There's no gray. Like this grayness of, oh, if you feel like it's good, voluntary, please. No, we need yes or no. And unfortunately, they didn't call Betsy Craig and ask me. If they do, I'm telling them. I bet you know that.
And there's definitely a lot of reasons on the manufacturer side where it's difficult for them to be black and white. However, especially if you're in a pediatric hospital, either use a nice database like Betsy's where she's checking in with people and look at their allergy safety plan so you get a much realer answer, or no. I mean, a lot of parents are going to say, no, I'm not going to use something with the may contains label. So that's a very, very tough question, and it has to do with our regulatory environment being fairly irritating for food allergy families right now. Just one more thing about that is a lot of parents feel like if something says manufactured on equipment that also processes peanuts, they feel like that's a really dangerous statement. But manufactured in a facility that also processes peanuts doesn't scare them as much. But there's good research showing that there is no correlation between the likelihood of allergens being in that food and how scary the may contain statement sounds. So you really can't go by that.
No, you really can't. Janelle, do you have anything further for us?
Yeah, actually, I do. First off, thank you so much to both of you for all this information. But yeah, I don't know if you addressed this earlier, Beth, when you were talking, but one of the questions is, you talk about the top 8, and it says we see a lot more gluten as an allergy rather than wheat. Is there a plan to add gluten to the top 8?
That is not pending in legislation right now, to my knowledge. However, almost everybody else, Canada, the European Union, a lot of other countries does include gluten in that list. And it's pretty interesting. If you go to Canada, which you can't right now, but go to Vancouver as soon as you can. It's really nice. But if you go to the supermarket and you pull out a loaf of bread, you're going to see in Canada contains gluten and contains sesame about 90% of the time as well, because those are required to be labeled. So we're eating that same bread. We're just not being told it contains gluten and sesame. So that would make our lives significantly easier as food service people if gluten was in the contains list, but currently it is not. I mean, the moderately good news is that you can't make false gluten-free claims without some ramifications because of that 20 parts per million threshold.
That brings up a point I want to make, and that is Allertrain at allertrain.com. I recommend folks at least get one person through the course. It's not a ton of money, and it's really a ton of knowledge. All of the stuff Beth's talking about, we even have a chart of all the international allergens, because people end up in your ERs and in your hospital from all over, not just your own zip codes. So especially coming down from Canada, they're expecting you to know all those allergens, and just lots of information. A simple course, a simple 2 hours spent on an e-learning can make a big difference for your executive chef or yourself.
Yeah. And I'll tell you one other thing, which is I know all of you food service directors love your dietitians, and Allertrain gives 2 hours of continuing education for registered dietitians and 3 hours for your certified executive chefs, or 3 credits anyway. And it is very inexpensive. And you also have the opportunity, if you're in a big hospital system, you could also designate someone to be a master trainer within your system and to actually be that Allertrain trainer. So that's another thing to think about.
Great. It's funny, you mentioned the Allergen program that you have. And Betsy, I took it a couple of years ago before I did a presentation with you or a webinar with you. And it's eye-opening. I mean, honestly, looking at how you handle it in the back of the house or in the kitchen to how the servers handle it. And I think it's kind of interesting. I can tell now when I walk into a restaurant where the staff has been gone through the Allergen training because of the way they ask.
Yep.
Also the menu, how it's addressed and stuff. But, we have a couple of minutes here. So I just wanted to ask you, I know this would take a lot longer to answer, but maybe a summary, or if a director wants to come to you and say, okay, where do we start? We want to really start addressing this more. What do I do first? What would you suggest?
So we have a couple different ways we can approach that. We get asked that question all the time. That's a great question. I should have fed you that question. That's a great question, but I didn't. we can start one of two ways. We can start to piecemeal it by putting people through training and trying to figure out what menu items you're trying to do that are free from, and verifying ingredients or signing you up to do the monthly database, that sort of thing. Or we can do the overreaching. That's why we've come up with that solutions, that fourth seal that I showed on the screen. Because the idea is we literally can come in and do an assessment. We use our audit software, but we do an assessment and figure out what's working and what needs some help so that we can partner with you. And then we go, okay, fine, you got to get training. This is what it looks like. This is what we think. You could do this area, but you got to move these 4 things. Go buy me a tabletop toaster or whatever, and help think through. Our favorite is when we get involved in a hospital system that's building a new building or a new cafeteria area, and they want to go ahead and save out a specialty section. And then, I mean, we do blueprints, all of it, because being the trendsetter in this space, which is a really uncomfortable term, but it's also true, we have helped a lot of people get out of jams and then also be proactive. I'd much rather be, you know, proactive than reactive. We can do both. We have incident response. We have, I mean, we can help, but I'd much rather get there before, you know, somebody ends up in your ER.
Yeah. And just sort of to get started, what I would recommend is if you're a food service director, get your clinical nutrition manager, other key dietitians, get your chefs that have to do with patient feeding, but also retail and also catering. We had one client that had made this beautiful dinner for the president of a university, and the president of the university had it like this and was going to take a bite to something that he was going to have an anaphylactic reaction to. So that is not how you make yourself popular. But take those key people, you know, put 6 or 7 people in the room together and do the Allergen manager level training together, and then send everybody on a scavenger hunt and say, what do you see? Now that you've just had this training, what do you see that makes you nervous? You know, what are we telling people? What are we putting on that flat top grill? If somebody's asking for a hamburger instead of a cheeseburger, are we making sure that they're not actually allergic to milk? Because we know the flat top is covered with all sorts of allergens. So I think just the first part of really getting your team together and getting that awareness raised can kind of lead you down the road to what's next as well.
Great. No, thank you so much. You know, we have a couple of minutes, so I think we'll go ahead and kind of wrap things up here. But I just really want to thank both of you. You know, right in the beginning of this, Betsy, you started out with the increase. Like, it's a crazy increase over the past, 10 years, people being diagnosed with food allergies. So, I mean, this is going to continue to be a growing problem, right? Or something that needs to be addressed.
Right, right. And thank you for having us. What an honor it is to share. I mean, my hope is that we shared something that you can think about and chew on, no pun intended, and maybe look at allergens a little bit differently. That's my hope.
Yeah, it's a lot to digest.
See what you did there.
So again, thanks to both of you and all of the great information you shared. I have your contact information posted for our participants. You know, this is, again, a lot to think about. So if you have other questions that come up, please feel free to reach out to Betsy and Beth. You can see their email addresses on the screen. I want to thank all of our participants today for attending the Association for Food Service Healthcare Washington Chapter webinar. We hope you enjoyed it. And yeah, thanks to everybody.
Thank you all. Stay safe.
Thank you.